Now, today is also World Tuberculosis Day, which is used to raise awareness about the devastating health, social and economic impact of this disease. It's also a day to focus on initiatives that can be undertaken to try and end this global epidemic. According to the World Health Organization, TB claims about 4,000 lives every day, with at least 28,000 daily infections. In fact, the global health body says time is running out for world leaders to make good on commitments to end TB. For context and a way forward, let's bring in Dr. Pule. She's a biomedical scientist at the University of Cape Town and joins us now via video link from Cape Town. Doc, thanks very much for your time, and it's great to have you on the program. So perhaps let's start with the lay of the land as it stands. I mean, help us understand what fighting the TB epidemic has been like in the context of the COVID-19 pandemic.
Okay, thank you for having me. So I would firstly love to talk about, some of the most important things, like the WHO previously post-2015 had a good strategy of NTB strategy, which was adopted into the National Sustainable Development Goals. So the challenge was that now, with the COVID-19 coming last year, it has brought us back a bit of few years back, in terms of like 12 years back, with the progress of global fight against tuberculosis. Reason being, most of the testing and the traces of TB had to stop due to more focus being done on COVID-19 and some of the health systems, like the facilities being prioritized to fight COVID-19 from last year. And the challenge is that one of this, global development goals was by 2030 that we need to have at least reduced TB incidences by 80%, TB deaths by 90%. And now, looking back, we are back at the start looking at what we used to have within 2008. So it has been a battle. Nevertheless, again, there is like a little bit of hope if we can navigate ways of dealing with both diseases, saying that we do have COVID-19, but we should not neglect the fight for TB. And one of the goals here is, that's why you see for this year's theme for World TB Day is the clock is ticking, as you emphasized it with that we are running out of time.
Yeah.
So the battle is still on, but we're moving forward better.
Right, and let's hone in on that theme. I mean, many people will say that it's a theme that could have had relevance from years ago. The clock has been ticking. The question then becomes, what makes us believe anything different will take place this year?
I think it's a very challenging question to bring forward in terms of what we are faced with currently. But I feel like with our understanding of the impact, the implications of COVID-19 on tuberculosis, and also the fact that now we are able to see both these diseases are respiratory infections, and now with understanding that we can think of ensuring that we put them as the most two important diseases, but we don't neglect TB in terms of how we continue with our research, how we continue with doing the tracing, the testing that we used to do, and also having more conversations about this, because we all know that TB has been in existence for a very long time. And compared to COVID that we currently, there is a development of a vaccine, TB, one of the challenges, which is why it's very difficult to eradicate, we are having challenges of getting the best vaccine. We have BCG, which is 100 years old, and it's not very effective for older adults. So I think the way of doing things differently now is a matter of where have we not done well and how can we improve in terms of ensuring that our health systems are strengthened.